Mr. President, I ask unanimous consent that the quorum call be dispensed with.
Without objection.
Mr. President, I rise today to speak of pragmatism and irresponsibility. 4 years ago, when this body was debating the law known as Obamacare, reasonable minds perhaps could have differed as to whether that law might work. The essence of pragmatism is looking to the facts as they are today and responding. Today, reasonable minds can no longer differ in terms of whether Obamacare is working. Today, it is abundantly clear that millions of Americans are being harmed right now by this failed law. Today, it is the essence of pragmatism to acknowledge the facts of the failure of Obamacare and for Congress to step up and act to stop the harms that have been caused by this body. Irresponsibility, on the other hand, is seeing undeniable harms, undeniable facts, and saying, nonetheless, we will do nothing. So, Mr. President, what are the facts from the American people? The facts that we now know today is that already at least 4.7 million Americans have received cancellation notices, have had their health care plans canceled because of Obamacare. And, Mr. President, this was, of course, after President Obama repeatedly looked in the TV cameras to the American people and made the promise, if you like your health care plan, you can keep it, period. We now know that promise was false, and for over 4.7 million people, painfully false in their lives. Pragmatism is responding to the facts and doing something about it. Unfortunately, what has the Senate Majority Leader and Senate Democrats done to protect Americans from Obamacare? Nothing. These facts are known, and Congress, Senate Democrats have done nothing. 4.7 million Americans lost their health insurance because of this body. The omnibus bill that this body is galloping to approve does nothing for the poor 4.7 million Americans who've had their health insurance canceled. But it's not just health insurance plans. What else are the facts that we know now? As Time magazine observed, keeping your doctor under Obamacare is no easy feat. Now, Mr. President, President Obama looked at the American people and said, if you like your doctor, you can keep your doctor, period. We now know that that promise, too, was deliberately, repeatedly false. Millions of Americans facing the very real prospect of losing their doctor. A good friend of mine is a cancer survivor, is facing the very real prospect, because Texas Oncology has suggested it does not intend to participate, of losing his cancer doctor, not being able to go to the doctors that saved his life. This is a father of 2 young children facing the terrifying reality of losing his doctor because of the conduct of the Congress. And, Mr. President, in response to millions of Americans losing their doctors, what has the Senate Majority Leader and Senate Democrats done? Nothing. The essence of irresponsibility is seeing a harm, seeing the facts, and refusing to act. What else do we know? We know that Obamacare is killing jobs all across the country. Indeed, Obamacare is the biggest job killer in this nation. The U.S. Chamber of Commerce has said of small businesses impacted by the employer mandate, 1/2 of small businesses say they will either cut hours to reduce full-time employees or replace full-time employees with part-time workers to avoid the mandate. 24% say they will reduce hiring to under 50 workers. The President has recently been talking about income inequality. This exacerbates income inequality. It's why the rich have gotten richer under President Obama. But the people who are struggling, young people, Hispanics, single mom, people like my dad, who 56 years ago washed dishes for 50 cents an hour as a teenage immigrant, Those are the people getting their hours reduced because of Obamacare. Those are the people getting laid off because of Obamacare. Income inequality is increasing. And Mr. President, what has the Senate Majority Leader and Senate Democrats done to protect Obamacare, to protect Americans from Obamacare? The answer is simple: nothing. In response to the millions of Americans being forced into part-time work, losing their jobs, nothing from Senate Democrats. What else do we know? The New York Times, front page headline explained, new health law frustrates many in the middle class. Now, Mr. President, I recognize that not everyone is inclined to listen to a Republican from Texas. So let me instead quote that famed right-wing rag, the New York Times, discussing Obamacare. New York Times talks about Ginger Chapman and her husband Doug are sitting on the health care cliff. The cheapest insurance plan they can find in the new federal marketplace in New Hampshire will cost their family of four about $1,000 a month, 12% of their annual income. As Mr. Chapman, a retired fireman who works on a friend's farm, and her two sons, Mrs. Chapman said, quote, "That's an insane amount of money. How are you supposed to pay that?" Now, Madam President, in response to the middle class frustrated and getting hit with skyrocketing premiums, what has the Senate Majority Leader and Senate Democrats done? The answer is the same: nothing. But going beyond that, it's not just the middle class who's getting hurt by this. If you were to look at one demographic group that is getting hammered perhaps the worst by Obamacare, it is young people. Obamacare is a law designed to be a massive wealth transfer from young people to older, wealthier Americans. 40% of young Americans today believe that Obamacare will bring worse care. 51% believe it will bring higher costs, and 57% of young people disapprove of Obamacare. And Madam President, what is the source of this? Another famed right-wing institution, Harvard. The Harvard Institute of Politics poll. Young people in particular are getting hammered by Obamacare. And Madam President, what has the Senate Majority Leader and Senate Democrats done to listen to the young people who are losing their jobs, who are forced into part-time work, who are facing skyrocketing premium? Well, the answer is simple, Madam President: nothing. Looking beyond that, Forbes reported that Obamacare is to increase individual market premiums by an average of 41%. 41%, that's real money from hardworking people who are being hurt because of the failures of this body. And what have Senate Democrats done in response? Nothing. Looking beyond that, in my home state of Texas, the average premium increase for Texans will be 26% in the individual market. But let's take a 27-year-old Texas man. The average premium increase will be 70%. For a 27-year-old Texas woman, 22%. These are young people who are struggling, who are starting to build a family, and their premiums are going up because of Obamacare. Now, Madam President, what has the Senate Majority Leader and Senate Democrats done to listen to young people who are being hurt? The answer is simple: nothing. Let's look beyond that, though. Let's look beyond Texas, and let's talk about, state by state, some of the very real harms. Let's take a state picked at random, the state of Nevada. If you look at the state of Nevada, 24,600 policies have been canceled in Nevada. In the individual market, a 179% premium increase. Now, one might hope that these 24,600 people who had their health insurance canceled would have senators representing them. One might hope that these people paying 179% premium increases would have senators representing them standing up and saying, "Let's act right now." But, Madam President, what has the Senate Majority Leader and Senate Democrats done to respond to the people of Nevada? The answer is absolutely nothing. Let's look at some other states. The state of California. California, that bright blue state on our West Coast. 1.1 million policies have been canceled. 27% increase on average premiums. What have Senate Democrats done to respond to Californians suffering because of Obamacare? The answer is simple. Nothing. Let's take another state, Arkansas. Arkansas people are hurting because of Obamacare. The state's not tracking cancellations. But in the individual market in Arkansas, a 138% increase in premiums. Now, for the millionaires, many of whom populate this chamber, 138% may not be that much. But if you're struggling in Arkansas, you need help, you need relief. And what have Senate Democrats done for the people hurting in Arkansas because of Obamacare? The answer is nothing. Let's look at another state. Louisiana. 92,790 policies canceled because of Obamacare, a 53% increase in average premiums because of Obamacare in the individual market. Now, I will note one senator from Louisiana has fought hard for those 92,790 people in Louisiana who have had their health insurance canceled. And another senator in this chamber has fought hard to ensure that the response is not to relieve them from Obamacare. What have Senate Democrats done in response to the people in Louisiana who are hurting? The answer is simple and it's tragic. Nothing. Let's look at another state. New Mexico. 26,000 policies canceled, 142% increase in the individual market. What have Senate Democrats done to listen to the citizens of New Mexico being hurt because of Obamacare? The answer is nothing. And let's take one more state. The state of North Carolina. 183,800 policies canceled. Madam President, I want you to think of the single mom raising 3 kids who receives a notification in the mail that her policy's been canceled, not because of anything she's done, but because of Congress's law that is not working. 136% increase. I want you to think of the immigrant struggling hard like my dad was washing dishes who discovers his premium has gone up 136%. What have Senate Democrats done to respond to the people of North Carolina who are being hurt because of Obamacare? And the answer, tragically, is nothing. Madam President, 4 years ago, reasonable minds might have differed. But today, these are the facts. And the facts are Senate Democrats are not listening to the American people. They are not responding to the harms that they have caused. And Madam President, I'm going to suggest that is the essence of irresponsibility. Now, Madam President, I have filed 2 amendments. One amendment to the omnibus bill would simply provide that Obamacare would be defunded so long as it is the case that Obamacare is causing Americans to lose the health insurance policies they wish to keep, increasing their premiums, and preventing them from seeing the doctors they want to see. All of those, by the way, were promises President Obama and Senate Democrats made to the American people that Obamacare wouldn't do, and it's exactly what they're doing. This amendment, if Senate Democrats disagree that they have done nothing, this amendment presents the opportunity for Senate Democrats to do something. Right now, they can step in and say, it is the essence of pragmatism to recognize this isn't working, people are hurting, let's start over. So accordingly, I'm going to ask the first of 2 unanimous consent requests. Madam President, I ask unanimous consent that my amendment number 2685 to prohibit funding of the Patient Protection and Affordable Care Act so long as the act is harming the health care of Americans be called up and agreed to.
Is there objection?
I object.
Objection is heard.
Madam President, I want to turn to a second amendment I've introduced. And this second amendment that I've introduced provides real relief to the millions of Americans who are being hurt because of Obamacare, but it also does something, it corrects something that this body did that was wrong just recently, which is just recently this body acted to decrease the pensions of millions of veterans, millions of men and women who have served our nation, who have fought for our nation, who have bled for our nation, and this body decreased their pensions irresponsibly. So this Second Amendment that I would introduce defunds Obamacare because millions of Americans are hurting, and it uses the savings from defunding Obamacare to restore the pensions to the hardworking men and women of the military, which never should have been taken away in the first place. This is an opportunity for all 100 senators to demonstrate that we stand together with the working men and women in the military and with all Americans who are struggling to make ends meet, struggling to achieve a better life. So, Madam President, I ask unanimous consent that my amendment number 2686 to prohibit funding of the Patient Protection and Affordable Care Act and to fulfill our nation's promise to our military retirees be called up and agreed to.
Is there objection?
I object.
Objection is heard.
Madam President, last year, members of this body could say they didn't know. They didn't know people's plans would be canceled. They didn't know premiums would skyrocket. They didn't know people would be shut off from seeing their doctors. Now they know. Now they know. And the response of the Majority Leader and Senate Democrats, tragically, is to do nothing. This body faces a choice between pragmatism and irresponsibility. And if once this body makes its choice, ultimately in November, the American people will have a choice as well. And at the end of the day, every elected official should not ignore the facts, but should listen to the American people. We need to make D.C. listen. And the Majority Leader and Senate Democrats right now are not listening to the American people. Instead, they have chosen a course of conduct, doing nothing, that is not responsible, and I hope that in time they reconsider. Madam President, I yield the floor.